What's really good is to loosen up the psoas muscle. It comes off of the side of the transverse process of L1 or T12. It courses through the abdominal area and attaches to the top of the ball and socket joint in the hip. So it's a big strong muscle, and if it's too tight it will pull the pelvis forward and put pressure on the back. So one of the ways to get rid of that tightness, I'll show you now, and this is the psoas. So it goes through, attaches to the top there. And one of the ways to loosen it up is to actually get in where it attaches to the hip joint and do some loosening psoas release techniques. I'll show you them now. And then we'll try and get the lower back adjusted so we can help improve the pelvis movements. So one of the ways is to use contact in the joint, then just take out, straighten, and it will cause a clicking sound and it will move over. And again, that should loosen it. Another good stretch, if you stand over there to see this way, for one of the other muscles which is on the back, called the quadratus lumborum, and that attaches from the back of the actual transverse process and to the back of this area on the iliac crests. So one of the ways to stretch that is now like this. If you hold the table both sides, take the legs out, now we'll stretch the QL down the side, so it's a lateral flexor, and we'll do the same. So you should feel a bit of a stretch through there. And then the other thing we have to do is, obviously we're going to try and loosen up the culprit area, which is the low back, which is a little bit restricted. And that's where we can do the chiropractic adjustment now. So I can get you to turn onto your side facing this way. Thank you. So nice and comfortable with the upper body. Again, you can use the back of the pisiform contact on the wrist, on the actual spine itself, and we're going to get this audible popping sound as the gas escapes from between the joint. So you get to line your back again, and that's one of the ways that we can help improve the back function, loosen up the psoas, and stretch out the quadratus lumborum at Perth Sports Injury Clinic.